What happens when you hold your pee too long? Holding your pee doesn't seem like a big deal, right? But what if your bladder is slowly stretching beyond its limit and weakening over time? Here's what actually happens inside your body. Your bladder starts filling. Your kidneys constantly filter waste from your blood, producing urine. That urine travels down thin tubes called ureters and collects in your bladder. The bladder is a muscular storage organ. On average, it comfortably holds about 400 to 600 milliliters of urine. As it fills, stretch receptors in the bladder wall send signals to your brain saying, "It's time to go." If you ignore that signal, your bladder continues to expand. Pressure and overstretching. The bladder muscle stretches like a balloon. Meanwhile, the urethral sphincter muscle stays tightly closed to prevent leakage. But when you repeatedly hold your urine, the bladder walls overstretch. Nerve signals can become less sensitive. The muscle may weaken over time. If this becomes a habit, you may experience difficulty fully emptying your bladder, weak urine stream, increased urgency later. Your bladder is designed to store urine temporarily, not indefinitely. Increased risk of infection. When urine sits in the bladder for too long, it creates an environment where bacteria can multiply. This increases the risk of a urinary tract infection. Common symptoms include burning during urination, lower abdominal discomfort, frequent urge to urinate, cloudy or strong-smelling urine if untreated. The infection can travel upward to the kidneys, which can become serious. In rare but severe situations, the bladder can become dangerously overstretched. Urine may flow backward toward the kidneys. In extreme trauma cases, bladder rupture can occur. While this is uncommon, it shows how important normal bladder function is. Final message: holding your pee occasionally is unlikely to cause harm, but making it a habit? That's when problems begin. Your body sends signals for a reason. Listening to them protects your bladder, kidneys, and overall health.